Hello colleagues, my name is Rolando Gomez and I'm the Executive Director of NALHE, and I'm here to launch a new national talk series in collaboration with our good friends at Hush Blackwell, NALHE Talks Policy. NALHE Talks Policy is a series of conversations that we're going to have with diverse leaders from across the country that will bring us various perspectives and experiences related to the legal, ethical, and policy challenges within our industry. For this first session, I leave you with the following leaders. Rufino Gaitan, Senior Counsel at Hush Blackwell's Houston office. Jim Rodriguez, President and CEO of TexHealth Central Texas and Senior Director of Finance for NALHE. Dominic Castillo, Associate Attorney in the Healthcare Regulatory Practice Area at Hush Blackwell, and also leading the reconvening of the Central Texas chapter for NALHE. So enjoy this conversation of NALHE Talks Policy. This session is about vaccine mandates.
Hello and good afternoon, and welcome to the National Association of Latino Healthcare Executives and Hush Blackwell initiative on podcast on vaccines. I've welcomed today Jim Rodriguez and Rufino Gaitan. I'm going to interview them today to discuss the state of the law and vaccines and kind of the compliance and regulatory measures that are that affect hospitals and healthcare providers. So why don't you introduce yourselves? Jim, why don't you go first and share a little bit about who you are and what you do?
Yeah, my name is Jim Rodriguez. I'm the president and CEO of TexHealth Central Texas. TexHealth Central Texas has been around for about 10 plus years. We started in 2009. I'm one of the founders or co-founders of the organization. And we're like small business advocates. What we do is we have a premium assistance program through the state of Texas, where people who are earning 400% of federal poverty level or less are eligible for a premium assistance program to help them pay for their health insurance through their employer. We pay 1/3 of the total premium up to $110 per month. So that's been a very, very good thing for a lot of people in the Central Texas area. We also assist small businesses who don't have an agent. We help them obtain a group health insurance. And in our advocacy work, we also offer premium only plans so that employers who are deducting health insurance, dental and vision insurance premiums pre-tax from their employees, they're covered according to IRS regulation. And that's basically who we are.
Great, thank you so much, Jim, for that. Rufino, would you like to introduce yourself?
Sure. So my name is Rufino Gaitan. I am Senior Counsel in Hush Blackwell's Houston office. I've been practicing for almost 13 years now, exclusively representing employers in all matters related to employment issues, including OSHA safety issues, discrimination issues, wage and hour, you name it. And in particular at Hush Blackwell, my focus has been in terms of clients has been within the healthcare sector, as I am a member of Hush Blackwell's Healthcare, Life Sciences, and Education Strategic Business Unit.
Awesome. Thank you, Rufino. Well, as mentioned, this podcast came about as a kind of an idea to discuss some of the issues that are affecting hospitals and providers with respect to the vaccine and the mandates that have come down from Medicare and the effects it has on policies and employment. Jim and Rufino are experts in this field, and I am a young attorney. I'm a young associate attorney at Hush Blackwell, and I'm really interested in kind of what's going on and what the state of the law on these vaccines and how they're affected. So this is going to be very conversational. I'm just going to ask some questions. Jim and Rufino, please feel free to jump in and share where you feel appropriate, and just have a nice kind of discussion about what's going on. So as we segue into our discussion. Kind of, I would like to know, as you guys understand it, what is the state of the vaccine rules and regulations, and kind of the state of the law for the vaccine mandates that are ongoing?
Well, I'll qualify my own personal experience with it, and that is that I'm not really involved in it that much because that's really been directed at large businesses. And it, you know, the constituency I represent are the small businesses. So I have not gotten into it very much. I did do a brief survey, which I will talk about as we go through the question and answer, but I will punt over to Rufino to kind of take it from here.
Sure. Well, you know, in terms of the big vaccine mandate that I think had a lot of media coverage and had a lot of employers kind of frantically trying to figure out what to do and what needed to be done was the OSHA vaccine mandate for employers that have 100 or more employees. That rule was actually enjoined by a federal court, and on appeal to the Supreme Court of the United States was also, the injunction was upheld. So essentially killed the rule, at least while the litigation was pending. However, given the opinion of the Supreme Court, I think OSHA essentially saw the writing on the wall and said, there's no way that this court is going to uphold some variation of this rule. They've essentially said we've exceeded our authority, and OSHA ended up withdrawing that rule. So it's no longer in effect, technically no longer on the books. However, OSHA has come out since the Supreme Court ruling and said that they do have other tools at their disposal to address health and safety issues in the workplace. And in particular, OSHA is going to continue to rely on what is known as the general duty clause to enforce health and safety obligations to protect employees. So essentially what that means for employers is, you know, you no longer have a hard and fast rule that you have to comply with. But if you were to have an outbreak of COVID-19 in your workplace, for example, OSHA would likely go through its typical evaluation process under the general duty clause to determine whether the employer acted reasonably in implementing policies or failing to implement policies that might have mitigated that potential outbreak. So, you know, we're not entirely out of the woods as employers, but you certainly don't have to worry about that big vaccine rule. The other big one for purposes of our NALHE audience, of course, is the CMS vaccine rule. And that one, unlike the OSHA rule, was upheld by the Supreme Court. And essentially, you know, it said that the CMS acted within its legal authority to issue that sort of a broad mandate. So if you are a healthcare service provider covered by the CMS regulations, you do have an obligation to ensure that all of your employees are vaccinated with very limited exceptions.
Right. Thank you for that. So from the OSHA perspective, if they have other tools, is it essentially a mandate, a vaccine mandate, or is it like a de facto kind of situation?
So it's not really a mandate. And of course, then you also have, now that there is no federal law for general employers, you do have sort of the competing interests of different municipalities that have enacted their own rules and you know, face masking requirements, those sorts of things. In the state of Texas, for example, Governor Abbott issued an executive order that would prohibit employers and other entities, so even businesses, from requiring vaccination. So it's all going to depend on your jurisdiction, and that's going to change from one state to another. But so you still have to contend with whatever, you know, state-specific requirements might be in place as well.
Right. Okay. And with respect to the CMS Medicare mandates, are there any policies in place that are as they move into the vaccination phase, like they have requirements? I understand that there's requirements for phase 1 and phase 2 of getting all their employees vaccinated. The phase 2 implementations, I think, were just completed on February 28th. And then basically what that means is that they're going to have all their employees vaccinated by a certain time frame. Are you gentlemen aware of any or how they're going to go about enforcing this? How employers are enforcing these vaccination requirements?
Yeah, so a lot of the employers that are covered by that CMS vaccination rule have updated their policies. We've assisted numerous clients in taking steps towards complying with those with the CMS rule mandate. And the timeline is going to be a little different too. There are certain states where I believe the deadline isn't until a week from now. March 15th is sort of the next big deadline coming up. And that's for employers in certain states. Texas has Texas employers have a little bit more time still until March 21st to comply with their phase 2 obligations. And that's just a result of certain litigation that was ongoing at the time. And so the timeline is a little different for different states. But yes, essentially what you want to do as an employer is you want to be proactive about those issues. You want to make sure that your documents reflect compliance with those legal requirements. And then on the actual execution side of that, you want to make sure that your employees are actually doing what they're supposed to be doing in terms of getting vaccinated or obtaining, limited exceptions for, certain accommodations under those requirements.
Right. And Jim, I know you from a more practical standpoint, you polled your clients. You asked them, were they working through the pandemic? And I guess I would pose that question to you. Did your clients tell you their employees continue to work through the pandemic? And now with these new mandates, kind of how are they enforcing them, and how are they crafting new policies?
Yeah, it's really interesting because 100% of my respondents said that they did work through the pandemic. Their employees did work. About 100% of them also said that they did not require their employees to be vaccinated. They just, and I have an interesting thing that one person said. The question was, when employees returned to work, did you require them to be vaccinated? And the answer she gave was, no, we definitely encouraged it, but it didn't feel like it was our business. People who work for small businesses don't usually like when the small businesses act like corporations. I thought that was an interesting little aside there.
Right.
Did you ever require proof of vaccination? About 94% all but one said no. Did you allow non-vaccinated vaccinated employees to return to work? And 94% said yes. Did you require new hires to be vaccinated? 88% said no. I would also like to point out we have this one medical clinic who responded and said, once vaccines were allowed and we were early to get them because we are a healthcare practice, we gave the option to vaccinate and wear paper masks and socialize together, or have to wear N95s if you didn't want to get vaccinated and not socialize. Once federal mandates were allowed, we required vaccinations. So that's what the medical clinic said. Another question we had is, did you allow any exceptions? And the medical clinic was the only one that would allow exceptions, although they said no one brought it up to them. And the only exception they would allow would be for health reasons. Otherwise, they were required. Of your employees, how many are vaccinated now? And about 86% said that their employees are vaccinated. It ranged anywhere from 70 to 100%. And so that's kind of the response we got from our small businesses. I thought it was very interesting and very telling.
I think that's really interesting, considering that they have significantly high vaccination rates, even though they weren't enforcing it right off the bat. They weren't encouraging people to get it, but people seem to be independently doing it. And let's segue into the exemptions and exceptions. Rufino, you mentioned that there are very few. Could you just tell us a little bit about the exceptions that you are aware of, exemptions that are allowed?
Yeah, so employers have continued to struggle with, the balance between respecting somebody's wishes to not be vaccinated. And there are two sort of variations to that, right? One is, do you allow exemptions for religious objectors, and how strict are you in terms of that analysis? And then what do you do about employees who may have, medical conditions, underlying medical conditions that may not permit them to safely get vaccinated? And so that is a struggle that a lot of employers have dealt with. What I continue to advise clients is, look, if you've got a requirement to vaccinate employees and an employee says they have a medical condition, they've documented it for you, you want to just kind of treat that like you would any other request for a reasonable accommodation under the ADA process, right? So you engage in an interactive process, you try to figure out whether there is an accommodation that you can provide that employee. It might be maybe you remove that individual from direct patient care, right? Or and have them doing clerical work or something where they're not as exposed, and you're also protecting, the degree or you're increasing the degree of protection for your patients or residents, whatever the setting might be. On the religious accommodation side of things, that's where we have actually seen, clients kind of everywhere on the spectrum. So some are very aggressive about trying to enforce, the broader discretion that employers have generally to deny religious accommodations for these sorts of things. And so you've seen employers who say, we're not really buying that you think this is a religious issue. And so they try to dig into that issue for the purposes of documenting their justification for denying it. We've seen others who have tried sort of the other end of the spectrum, which is, if you tell us that it's a religious issue for you and you don't feel comfortable getting any of these vaccines, we're not going to force it on you, and we're going to deal with the ramifications of that. We'll try to accommodate you however possible. And then you've got everything in between, right? Those who are really trying to just do what's right by their employees, their patients, residents, other clientele, and trying to sort of walk more of a middle road. Ultimately, I think the more important thing for any employer is you want to make sure that you're documenting that process, that you've engaged in a discussion with the individual. And at the end of the day, I just don't necessarily see whether it's the EEOC or any other federal agency taking issue with an employer, as long as they're being consistent with how they are administering those types of exemption requests.
Right. That makes sense. Jim, do you have any experience, or have you heard anything from your clients regarding the exemptions?
No, I haven't. I think that, like I said before, I think they are taking kind of a hands-off approach to their employees. They're letting them make their own decisions. And frankly, I think that the vast majority of the small business employees have gotten vaccinated. And, if there are any that have not, I don't think they're making it's kind of like a don't ask, don't tell situation, don't bring it up and nobody asks you about it.
Are they making any changes with respect to new hires or new employments? Are they trying to ask, are they asking, or do you have any policies in place for new hires with respect to the vaccination?
No, and the reason is because, it's really hard to find staffing right now. It's very hard to find people to work especially in the hospitality industry, and any of the lower paid industries are having a very hard time finding and keeping employees. And so as a result of that, they don't want to, turn someone away by asking them about their vaccination status, I'm sure. I really doubt anybody's asking them that kind of a question.
And Rufino, is that kind of the what you're counseling clients is to stay within the boundaries of the law, but because there are significant challenges in staffing, nursing, environmental services. I think historically this is called the Great Resignation. A lot of people are leaving jobs and changing, and priorities have adjusted since the pandemic. Is that kind of the view that you have?
Yeah, again, I've seen clients take different approaches to this. And obviously we try to tailor our advice, based on whatever the client it is they want to do, their goals, which do change from one organization to another. But like Jim just said, there's so many factors right now that have come together. The timing is perfect right now for creating a lot of issues on the recruitment side, right? So you mentioned the Great Resignation. We've had a huge exodus of people leaving the workforce, some of them altogether, some of them leave because they find a better opportunity, and whether that's better from a financial standpoint or better flexibility in terms of hours and working conditions, you're seeing that sort of migration, right? If you've got an employer who's on the bad end of these sort of, phenomena, you're going to be less inclined as the employer to be really strict about what you're asking employees to do. And I think that's just the practical reality of the current market for employees. On the other hand, there are employers who probably have a little more flexibility in terms of maybe paying more than the current market standard for a particular job. Those employers might feel that because they're paying above market or slightly better rates than their competitors, they might be in a position where they can put more strings, onto an employment offer. So it really is going to depend. But ultimately, there are ways to accomplish any of those goals in a way that you still comply with all of your legal requirements. It's just a matter of making sure that as the employer, you understand what those are and that you seek the proper counsel before you implement any sort of broad strategy.
Yeah, I would also interject that I think anybody in the healthcare service delivery field probably have a little bit more stringent requirements than even in the small business kind of scale, which, physician practices are generally small businesses. But I think they would be the ones that, you would see more of a rigid kind of approach.
Yeah, in that rigid approach, I was kind of curious if you gentlemen, you may not have any knowledge to this, but within the Latino Hispanic community, that people often have less access to vaccines and to healthcare in general. Are we seeing any kind of disproportionate impact within the community? Whether that be hiring, finding jobs, like, I can't work here as a nurse because I haven't been vaccinated or I don't have access to vaccinations. I don't know if either of you have any thoughts on that subject.
Well, I can tell you that according to the CDC, at the end of January, the white population was about 56% had at least one vaccination. The Latino population, there were about 20%. The Black population was about 10%, and the Asian population was about 7%. So I think across the board, there's just not been a lot of uptake on vaccinations in general. To get only one vaccination out of three, it just seems like it just hasn't been really taken to. I hear a lot from the local community, the local Latino community, that the Latinos are being left behind on vaccinations, and there are organizations here locally in Central Texas who are working in the community to get more people vaccinated, and I applaud their efforts. I think that is something that needs to be looked at, needs to be worked at.
Yeah, and I think the last sort of information that I looked at, initially on the front end of when the vaccines were rolling out, there was a pretty big disparity amongst, I guess you can say, from one race to another. And I think the biggest chasm was likely between, the overall white population and African-American population. The Latino community was a little bit less, the percentage of people getting vaccinated in the Latino community was sort of in between those two. But I think a lot of that the gap in the rate of vaccination has narrowed as we've progressed through the pandemic. And I believe I read something recently that the gap for Latinos has actually almost been, erased. So Latinos, I think, are finally coming around to getting vaccinated at the same rates as the broader American population.
Rufino, do you think that that gap has affected employment of Latinos?
Well, that is interesting. I think that, early on, we saw a lot of anecdotal information about, how the pandemic was disproportionately affecting minority employees versus white employees. And I don't know that that trend has necessarily held up. But I do think that, to a point that Jim made earlier, when you're talking about lower wage earners who, you may not necessarily, and I think that Latinos and African Americans make up a bigger portion of that workforce than do white Americans. And so that group, that economic group, I think has tended to be more willing to leave the workforce. And I think that does impact sort of, how certain groups within our communities view this pandemic and kind of either want it to be done and are ready to get back into things, or are still being cautious about when it's appropriate to go back into the workforce, if at all.
Yeah, I would like to add that I think a lot of those folks who are in that socioeconomic strata, for them to take off time to go get a vaccine, it means they don't get paid for that time that they're out. So, that has a huge impact on a lot of people, who have to provide for their families, and that they're basically hand to mouth kind of existences. So, that's something that you need to get to also take consideration.
The cost benefit analysis is something that is always important to consider, particularly when you do have those wage earners who rely on those, and access to transportation, getting to the vaccines, getting to places where they are being distributed. Do you guys think that there are that groups like NALHE and can help spread awareness of these issues? And do you think it's a lack of information as to why there's maybe been a slow response to getting vaccinated?
I don't.
In the Latino community.
Yeah, I think, like I said before, I think that there's groups in the community, in every community, that works towards helping Latinos, get the things that they need. And I think that, if NALHE can do anything, it's to support those groups who are already in the community, who have the relationships established. For NALHE to come in, and organizations like NALHE, they have to be partnering with these types of organizations that are in the community already to really, I think, have any impact.
Yeah, I agree with that approach. And I think that, it's sort of human nature. I think that if you hear a message from somebody that kind of looks like you, or that you can relate to, there's a certain sort of ingrained level of trust there, right? And so, if NALHE can, and I know that there are efforts among the organization already to do this, but the more we amp up that message, I think the better results we're going to get. And partnering with local communities and local organizations, I think is probably the best way to achieve higher levels of vaccinations amongst the Latino community. Of course, there's always going to be resistance by certain, members of the community. And I don't think that's necessarily the target audience, but you do have people out there who have legitimate questions and concerns about, the safety, the efficacy of the vaccine. And I think that NALHE is perfectly positioned to address those issues in a way that is, not driving an agenda, not turning it into a political talking point, but just providing people information and letting them make that decision for themselves once they have, information that helps them make an informed decision.
Right. I thank you for saying that, because that's kind of the idea. And the idea behind this podcast was to share some general information about the impact of the vaccines and on employment and employees, and particularly within the Latino healthcare or Latino space, because having access and then having the proper information without being persuaded by one group or another, laying out the facts and having the information you need to make a decision, I think is really important, particularly when you do have, disagreements from what seems like the powers that be. And you have, Governor Abbott passes a regulation on you can't mandate vaccines, and then you have the federal government saying, well, we are going to mandate vaccines. And it's like, well, who do we believe and who do we trust? And that kind of, that just provides distrust across the spectrum. So as we move into the conclusion of our podcast here, I would like to just open it up for you guys if you have any questions or would like to share any parting shots before we go.
Not for me. I'm very happy. I appreciate being invited to this. I've enjoyed the discussion, and I want to thank you, Dominic.
Yeah, likewise, Dominic, thank you for hosting us, and thanks to NALHE for the invitation to participate in this. I hope that it becomes, a regular podcast series, and not to invite myself back, but I would love to be back if NALHE will have me.
You guys are experts. You are brilliant. I appreciate it. I'm learning so much, and I really appreciate it. We'll hope to have you guys back soon. Thank you.
Thank you.
Thank you.